So if you look really closely at the clinical data on blockbuster weight loss medications, like Ozempic or Wegovy, their success actually hinges on this bizarre physical mechanism. They basically paralyze your stomach just enough to delay emptying.
That is just such a staggering biological shift when you think about it. I mean, for anyone who has dealt with metabolic slowdowns or the endless frustration of failed diets, it is so validating to see proof that their hormones were actively fighting back.
Yeah, you hit the nail on the head regarding those hormones because the research proves this isn't about willpower at all. Our goal for this episode is to explain the biological how and why behind these GLP-1 drugs, starting with how they, intentionally hijack your digestive system.
I am really glad we are getting into the actual mechanics here. I mean,
Yeah.
if our bodies fight calorie restrictions so fiercely, how exactly does deliberately slowing down our stomach break that cycle?
Well, it essentially comes down to targeting specific GLP-1 receptors in your stomach wall, your brain, and the vagus nerve. And that nerve acts as this massive information highway connecting your gut to your mind.
Oh, right, the whole gut-brain connect.
Exactly. So when the medication hits those receptors, it reduces stomach contractions and physically tightens the pyloric sphincter at the bottom of your stomach.
Okay, so if I am understanding correctly, it is almost like installing a metering light on a busy highway on-ramp.
Yeah, or like a nightclub bouncer intentionally slowing the line so the digestive system doesn't get overwhelmed. That extends your fullness and really smooths out those blood sugar curves.
Wait, let me challenge that for a second, because that sounds potentially dangerous to me. Like, if the food is just sitting there, aren't we risking a severe condition like gastroparesis?
I totally understand why you would think that, but the clinical research clearly distinguishes between a controlled delay and a pathological stoppage. The medication just extends the emptying time safely. It doesn't freeze the digestive tract completely.
Okay, that definitely eases some of the anxiety around these treatments. But looking through our notes on the long-term data, doesn't the body inevitably try to fight back against that artificial delay?
Yes, it absolutely does, and this is where the science gets really fascinating. Through a process called tachyphylaxis, your body eventually realizes its baseline has been altered.
Right, so it tries to fix it.
Yeah, it starts upregulating its own nerve signals to force the stomach to speed back up to a normal pace.
So the body forces a return to homeostasis, which makes perfect sense biologically. But wait, if the stomach eventually speeds back up, why do patients keep losing weight and feeling full?
That actually puzzled researchers initially too, but it turns out the gut-brain connection is doing double duty here.
Oh, wow, really?
Yeah, even after the physical stomach slowing effect fades, medication keeps directly stimulating the brain's reward and satiety centers. So you fundamentally just stop obsessing over food.
That dual action explains so much about the long-term efficacy, but it also brings up a really practical issue about the early stages, right?
You mean the side effects?
Exactly, because the research notes 15 to 44% of patients experience nausea or constipation as they ramp up their doses.
Yeah, those gastrointestinal side effects are exactly why the medical community's approach to prescribing these drugs is rapidly shifting. The data shows that relying solely on the medication is a massive challenge.
Right, especially without a strategy for mitigating that nausea or preserving muscle mass during the rapid weight loss.
Exactly. Which aligns perfectly with this emerging trend we kept seeing in the data. Patients are having the most success when they move away from just solo medication use.
Yeah, something that kept coming up in patient discussions and case studies for this episode was medically supervised GLP-1 programs.
Right, those physician-guided programs pair the medication with strict nutrition support, behavioral coaching, and active medical monitoring. It is a comprehensive response to how complex this metabolic intervention actually is.
Interestingly, because those supervised programs kept coming up so often in the research we reviewed, we actually put a link in the description for you if you want to see how they work.
Yeah, it just highlights that this is so much more than a simple appetite suppressant. So stepping back for a second, what this really means is that delayed gastric emptying is an intentional, multi-system metabolic intervention.
It really forces you to reevaluate the entire mechanics of weight loss. And it leaves you wondering, if the physical stomach slowing effect actually fades over time, how much of our long-term health relies entirely on fixing the brain's underlying relationship with food?